survivor, we got two states. The one is Penang. They got 1,080 in the public space, and the Sarawak is enforced mandatory AED in all the public spaces. So the benefit of the AED is going to restore the heart signal. When the heart rhythm is abnormal, you got two rhythm is abnormal, they will shock. We admit basically the heart pumps too fast, then they will shock to reset the electrical system again. And then it's user friendly, and so it's automatic shock. Basically, you just need to press a button to give the shock. And when you give the shock, make sure no one is touching the patient, the victim. Because if someone touching the victim, even the toe, they can feel the shock also. Okay? And this is the survival rate of CPR will increase with the AED. And this survival rate of CPR and AED. If we do perform both CPR and so AED together, we increase the survival rate of the victim. So this is just to show that they use an AED and they save a man life. So the detail of the AED, they will give another talk later by the very low. So now we're going to the next topic, choking. So later we're going to have two demonstrations. One is the one-man CPR and the other one is choking. We're going to demonstrate that. For the choking, the universal style of choking is going to holding the throat. In their choking. So basically there are two types of choking. Before that. So there's a few choking cases in Malaysia. Unfortunately, a few die because of choking. And we can either choke on food or even like babies, they will eat, put some toys inside their mouth, they can choke also. So there are two types of choking, mild obstruction and also severe obstruction. For the mild obstruction, so the victim they still can breathe and also they can cough. So for mild obstruction, we just ask the victim to cough. So for like coughing, the things will come out. Let's say they cough for 10 minutes, the things will come out, then you have to either call or perform the abdominal thrust. You cannot ask the victim to cough for half an hour, right? Okay? For the severe obstruction, they're going to contour the neck, they will be weak, they cannot cough, maybe they can make a high-pitched noise. For this one, we're going to perform abdominal thrust or handling maneuver to remove the obstruction, also to call the CPR. In some cases, if the patient with the victim become unresponsive, we have to begin the CPR. So far, okay, right? So how we do the abdominal thrust? We're going to make a fist with our hand, put your thumb inside, and then make a fist. We're going to put your fist above your navel, and then we're going to push upward. And this one we call abdominal thrust, but in some case when the victim is pregnant or is a bit obesity, they have big stomach, we will do the chest thrust. We will put the hand, it's the same thing, but put on your chest and push. So just in case you have alone, nobody there to help you when you're choking by yourself, you can use you can use a chair to help to push it. A higher chair, so they can. So for any question on choking?
Would it be the same on babies?
Baby, the step is a bit different. Because baby you have to back slap and also turn in front to press.
Just ask.
Chest thrust. So this one we just, for the adult, we just push until the thing found the patient become responsive, right? For the baby, we'll give 5 back slap and then 5 chest thrust to turn the baby. Okay. So, do you think Mr. Lee is doing it correctly? Correct lah, he's trying to save the patient's life. But he did using the wrong technique. So we have to make sure you do the CPR using the correct technique. Okay? So, because of COVID-19, we're going to promote hands-on CPR. If the patient is unconscious and you're not sure whether the patient got COVID-19 or any respiratory disease, right? You have to make sure the patient victim is unconscious. You just call 999 reduction to less than 10 seconds.
Yeah, but how long, what's the duration like?
But if you really cannot get the AED, you just perform the
Yeah,
CPR only.
what I'm saying is when you're doing the CPR, you ask somebody else to go and get the AED, what's the duration?
But they don't have any duration. So we're waiting for the AED, just continue to do the compression.
The AEDs nearby moves at the station or whatever. Sometimes it's place like the badminton court or sports center and all this, so it's like within minutes.
Yeah. I mean, let's say the AED is very far, so another person go and take, just continue to perform the CPR.
Depending on the location of the
Yes, there's no like, you have to get in between half an hour, they don't have the time limit. So just we're waiting, just do the CPR only.
Because I was thinking like when it takes about half an hour, maybe the ambulance is faster.
Because they can do it faster, they don't have to wait for the CPR. Don't have to wait for the AED lah. Like, wait, I have to wait for AED first, no, right?
Yes. If you are the first responder, you must start the CPR first and have someone to fetch the AED. Bukan you yang pergi ambil the AED.
So as long as the AED arrives, then we can stop.
AED arrives, stop the day, push the press, start the mission. And for the touch.
And you're saying just now that nobody is supposed to touch the AED because it's a shock.
Not touch the victim, not the AED.
Yeah, the person waiting. So meaning to say for us who are performing it, okay, when you're doing it on the person, you're not supposed to touch the victim also.
Yes, you cannot touch the victim when the AED analyze the rhythm and when you give shock.
Yes.
So when you say they analyze the rhythm, shock is advised. So they will say, you have to press the, make sure it's clear. Just universal command like clear. You cannot touch the patient. Then you press the shock button. After that, they will ask you to continue the compression. So the AED will automatically check the rhythm every 2 minutes. So supposedly it's 5 cycles, 2 minutes. If you follow the rate 100, 120, you're going to complete 5 cycles of CPR within 2 minutes. Then the AED will automatically check the rhythm again. So let's say shock is not right, then you continue CPR for another 2 minutes. You shock is right, then just give shock.
Excuse me, I saw on TikTok, I don't know whether it is true or fake, you know. In China, they have these gadgets when you have choking, and they use the gadgets to put on the mouth to like push the vein out, whatever stuck. I saw it in the TikTok, I don't know whether it's such things or not.
Oh, I don't have TikTok, but I'm not sure.
We will try to report. I got a very important question. We've been talking right now about what to do after you identify whether cardiac arrest or choking. But I have been in situations where identifying that situation itself has been complicated. I think, for example, this is a real life experience that I had. I was in the LRT, someone just fell, right? And everybody just looked around in shock. Not sure what was happening, whether it was a fainting or whatever. It took almost about 2 minutes before somebody said, the person is not breathing.
Because it doesn't have training.
No, what I meant is, when the person falls, collapses, right? It's the reaction time for people around to identify that this is something really serious enough. Now, how do we address that? That's the question I think. Even I didn't know how to respond. And I am trained in CPR. I mean, I have got first aid. I didn't, because it's a woman falling. I don't know how to react because she's very too low, you know. Like, you got to get the social situation here. That's what I meant. How do we address that first before we even talk about providing first aid?
So basically, you got two death. There is not say clinical death, right? You can perform the CPR within the first 4 minutes.
No, identifying that this person needs help and not just fainted.
So like say, have to check for response, check for pulse,
Yes.
check for breathing.
The three situation, unconscious, no pulse, no breathing. And understand, let's say the lady tu pakai tudung, you tak tahu, you nak pegang ke tak pegang, or anybody, or you can ask the son or any relative, or let's say nobody, you can perform yourself, just give the person, the trainer as honor. But in Malaysia, you don't worry. I ada attend satu course with the law of our magistrate. This Ketua Hakim Mahkamah KL Kuala Lumpur just come here for do the BLS. So we ask the hakim ni, there is any law tak yang boleh menjatuhkan hukuman sebenarnya kita do the CPR and then the patient die, then this relative sue kita. Dia kata tak ada lagi this akta in Malaysia. So you don't worry. But in the outside of Malaysia, yes,
They got some good Samaritan law.
I just think what the gentleman is referring to might also be related to, I'm not sure, all this kind of the bystander effect. Like if you're only alone with a person who loves you, you wouldn't usually check what's going on. Whereas as soon as you have more people around you, everyone is going to expect everyone else to check on that person. So this bias exists, and maybe that's what was referred to here. It's just like someone collapses in the MRT, everyone looks at each other and expects someone else to intervene, which takes some time.
So after that, then the cost will be the first responder.
But wouldn't it better for you to actually shout out because if somebody is familiar with CPR, then you come forward?
Okay, you can first confirm first time or any
Yeah.
professional around here, then do it. Really no one that can do this.
And the other thing, I'm just wondering, if you're wearing a tie or suit or something like that, if you feel that the nose and then the pulse, yeah, is not there, should you take off the pulse first or you straight away do the CPR?
So you can straight away do it on the floor. And for the AD, you have to remove the cloth and place it on your body. AD no need, you can do it on the floor.
CPR.
CPR no need. Sekarang the AD need to put on the body. Check.
So for the first action, like someone is collapsed, then it's like, are you out there? You are asking her
Yes.
to then any response, and then you need to lie her down or wake up her.
You're already right now.
Okay, okay. Once they call it already lying down, right? Just make sure the victim is lying down on a hard surface. Because they say the victim collect on a it's not hard surface when you press right, it's going to push the patient into the on the surface. So
But the first action that we need to
yes, yes, right. Press tap on the shoulder, are you okay?
Are you okay, right? Wait until no response, then start to do it.
So the one is like minimize interruption less than 10 seconds. So you like, are you okay? Check pulse, check breathing, everything is less. Check pulse, check breathing, all less than 10 seconds. Right? So you're not sure whether you're checking the pulse correctly or not. That's why if you feel like no pulse, the patient is conscious, you just try to do the CPR.
When you say hard surface, what about this on the bed?
You have to move the patient down to the floor. The bed is a bit soft. So far, okay. Any more questions?
Easier to check here or easier to check?
It's easier to check here.
It's very difficult.
Actually, you can feel your
I'm
pulse,
trying.
right?
It's 1 hour. Keep trying. Cannot left or right.
Both
ma,
yes,
right?
either one.
Yeah, if
So
you
the center is
you try left. Yeah, I can find.
Snap the side. Get the groove behind.
You must press harder, you must press harder.
But not too hard.
Another time.
Until you feel it,
Later you
otherwise not together. You can't feel it until.
if respond, then only to do CPR lah. I'm sorry, it's fine. I think the corresponding patient for pulse and no breathing lah. That's why the first thing is unconscious first. Only check for pulse and breathing. So, okay, right? You're just going to do the video for the hands-on CPR.
Here's the fact. Heart disease causes 1 in 5 deaths in Malaysia every year. You can help save a life in just 2 steps. First, call 999 and get ambulance. Next, perform CPR. This can keep a person alive until help comes.
But I don't know how.
It's very easy. Use hands-only CPR. First, you just need to place your hands at the center of the chest. Then push hard and push fast. Keep going until help arrives.